Hello, and welcome to the symplr Education Series webcast. Today's webcast is the R&D of Privileges with Julie Costa-Bickmore, CPCS. I would like to do some introductions now. Today's webcast is brought to you by symplr. Next slide, please. Next slide. Today's webcast is brought to you by symplr. We are so pleased to have Ms. Julie as our speaker today. She is a credentialing and privileging consultant with us here at symplr with many, many years of knowledge. I would like to let everyone know that an archive of this webcast and its slides will be soon downloadable at symplr.com, and you will receive an email with these download instructions within a week. So you will be able to view this webcast recording and see its slides at symplr.com soon. I would love to introduce Ms. Julie to y'all, and I would like to hand it over to her now.
Thank you, Callie. It's a pleasure to be with you all this afternoon. It's a beautiful day here in the great state of Tennessee, and I hope that you're all enjoying your weather there. I did want to make mention of one small thing because it always irritates my husband. I hyphenate my name, Costa-Bickmore, because I was born Acosta before I became a Bickmore. So just wanted to add that side note. Most of you may know me as Costa, and since at that time I have gotten married, and it's been pure bliss, which I know you all understand. I'd like to begin today with the topic of research and development when it comes to privileges, and a little bit about the research and development of privileges. We all know, those of you that are listening, I know that you're listening because this has been a task that more than likely you've been given, that is one that can create a lot of confusion in your mind. And I want to try to clear that up and kind of give you some information that would help you through your own individual process. And as we're thinking about research and development, we want to be sure that as we go through this process, that we are providing the most credible information that we can possibly find. Because most of you have been charged with this responsibility, though originally it belongs with the physician leadership, but the physician leadership, though they may or may not want to take on this responsibility, they've been trained to do clinical procedures, and that's what they want to do more than anything. So we've seen an evolution over the years where this part of the development and research of privileges and specialties has fallen on you as medical staff service professionals. So as we get started, one of the reasons that we do so much research and development when it comes to privileges, those services being provided within our facilities, is really threefold. And I know that you've heard this over the years, but I'm such a firm believer of these. It's number one is for patient safety. We're doing this for patient safety because we want physicians and practitioners in our facilities that know what they're doing, that our patients are getting the best care possible. So there's a real sense of urgency of patient safety. The other reason we do this research and development is it protects the practitioner or the physician, to show that we've done our due diligence to make sure that who we have brought into our facilities, that they've gone through this rigorous training and the criteria that we've established. And if anything ever happens, we can show that we have done all of this before bringing this provider or practitioner on board, and it protects them, and they kind of have a sense of comfort when that happens also. And also it protects the hospital, because you always want to advertise or send any family members or anyone health plans that your hospital has done the very best job that it possibly can do when it comes to doing the research and development. Now, you hear the word core often, and this is how I have defined core. It can be complicated, it's overwhelming, there's some reluctancy when it comes to this process, and it can be very exhausting. And we've heard the word core kind of invented, many years ago. And there's there's some confusion when it comes to core. Should I have core privileges? Should I bundle my privileges? And what basically that means is, are we going to have a list of privileges that they're able to perform as soon as they get out of their residency? Or do we want to bundle everything like in categories that they can do? And what I believe in doing is that we end up doing a mixture of the two, because you have to know how you're going to measure these privileges. And that's when everything starts to get so confusing and you feel so lost, like, so now what do I do? How am I going to do this with all of the other responsibilities that I have on my plate? And the only way that you can do that is you have a process. You get a process in place. And there are several things to take into consideration before we begin the process. We look at what are their requirements? What are the requirements of the accrediting bodies? And there are two mainly accrediting bodies that we focus on, though there are several that are out there. But the Joint Commission looks at core privileges, and their position is that basically it's activities for which the majority of the practitioners who meet the defined criteria should be able to perform. And also that we must define the specific activities included and limitations that, including those outside of the core. And those that are taught in the core or in their residency or their fellowship, those are taught outside of the core, or any privileges that require additional training, just so that we're clear on that. And what CMS says, this is their position, and you can see they're very specific on their position, is that the bylaws, medical staff bylaws, must state the duties and the scope of the medical staff privileges. Each category practitioner may be granted. Specific privileges for each category must clearly and completely list the specific or limitations for that category of practitioner. The specific privileges must reflect the activities of the majority of the practitioners in that category that can perform competently and that the hospital can support. And that's an important thing to know, something that the hospital can actually support that. Now, there are three different types of physicians that we have. We have the ones that are just coming out of residency and they're so excited to actually begin their clinical practice. So there's that type of physician that comes out. And then we've got the physicians that have been there way too long that we have to take into consideration as well. And then we have the physicians that have been there so long that they're a little too comfortable now. And these are three different reasons of why we have to have a privileging system in place with good research so that we can know what it is we need to do moving forward. Now, just with this little bit of information that I've given you, it's a lot. It's very, very overwhelming, because this is not the only task that you have to do. There's credentialing, there's all the meetings that you run and coordinate. There's even down to the birthday cards and anniversaries that you're keeping track of for your administrator or your CEO. There's just a lot on your plate. There are three areas of research and development. And as I'm going through this presentation, as you have questions, please write them down and we will address them at the end, because this can be a little overwhelming. The three areas of research and development are your specialty core privileges. And we know that, again, that those are the privileges that are taught in your internship and residency. So right out of school, there's a set of privileges or procedures that you should be able to perform right away. There's also special privileges. Now, with the special privileges, those are privileges outside of your basic training of internship, residency, or even a fellowship that requires additional training. So you need to go outside, either to a proctor or another facility, somewhere else that's not just taught in your school, the school that they're coming from. Also, there's new technology. There's new technology evolving every day, and physicians that wanting to get on board with that new technology that is coming to your hospital as well. So you're responsible for trying to figure out what you need to do to make sure that the information you obtain on technology is credible as well. So what are some of the recognized credible sources? We've got our medical training institutions, you've got physician specialty and procedural experts, you've got your specialty boards. A lot of us are most familiar with ABMS, but the individual specialty boards, even those that aren't members of that board. You've got medical journals. Medical journals are full of information. You've got your device manufacturers, and then you've got the FDA. And I will concentrate a little bit on the FDA in just a minute. But these are some credible sources that you can go to in obtaining the information that you need to start the development of either your specialty privileges or your special privileges. Some of the example of the medical training institutions, which most of you I'm sure are familiar with, is the ACGME, the AOA, and we know that those two have got a collaboration going. There's the American Dental Association, there's the Podiatric Medical Education, there's the Nursing College. There are several medical training institutions. This is just an example that you can go directly to and find out what their curriculum consists of. And some of that can be confusing, but it's just a lot of asking questions and doing the research to pull that information in, because they want you to have the best information also as you're bringing these practitioners on as well. A little bit about practitioner specialties or procedural experts. You can glean a lot of information when you're developing, let's just say on your core specialties, your primary specialties. You can go directly to a medical director for the ACGME, and there's a listing of that on their website of who the directors are for those specific programs. And you can talk to them about what their curriculum is like. You can also do research on facilities, teaching facilities that are ACGME accredited, and see what their curriculum is like and what privileges and procedures that they teach in their individual programs. That's a really good thing to do. You can also contact, you can find out who some preceptors are, or proctors, or any trainers. And in this area, you can find that out if you have a physician that's coming to you and wants to perform an ABC procedure. You can find out where did you receive your training, and then you can work backwards on gathering that information as well. As if they're telling you they got it from, EFG company, you can contact that company and work backwards, find out a little bit about what their training program is like, and making sure that that physician went through that training program. There's also associations, many associations and academies and colleges and societies, whether it's cardiology or radiology or thoracic surgery. There are many, many associations and academies and colleges and societies that you can contact directly. They're more than willing to help you as well. What I have noticed over the past little while is they want to charge you for everything and every question that you ask, but it's better to pay the price to get the correct information than to try to make a guess of something. Medical journals do take a little bit more time and research because you've got to read them, but they can be very, very helpful, especially on your special privileges. And some of those medical journals are the JAMA, the New England Journal of Medicine, Oxford, the U.S. National Library of Medicine, National Institute of Health. Elsevier, you can go contact them and they can hook you up with a lot of different articles. But it's really good to become knowledgeable on the privilege that you're trying to develop the criteria for, because as you arm yourself with knowledge, you know what questions to ask moving forward with the physician, and be able to answer intelligently questions that your medical executive committee or credentials committee would ask as well. For special privileges, device manufacturers or new and existing technology. I've listed just a few of them that I've worked with. We've got Boston Scientific, Da Vinci Medical Systems, Johnson & Johnson, Medtronic, and then there are centers of excellence. Now, when there's a new piece of equipment that comes out, more than likely there is training that is involved with that piece of equipment. And what the best practice to do is to go directly to the manufacturer, because they do have education programs in place. You contact the representative. You don't even have to have that equipment in your facility yet. You can contact them and talk about that, like I'm working on right now, called the one right now from Electronics called the Venus deal. And so I'm working with an individual. I had to start with the sales rep, who's now put me over with the training people. And I want to know, what are the prerequisites for a surgeon to use your piece of equipment just before he can take the training? And then once he gets into the training, what does your training program entail? Because again, you need to find out everything possible about what is required for this piece of equipment. Because again, you want patient safety on your mind. You want to make sure that practitioner is competent, and you're trying to protect your hospital. And a lot of these, I know Medtronic does, and Boston Scientific and Da Vinci does, they've got centers of excellence. And some of the centers of excellence are in their own facilities, or they are partnered with some other hospitals and teaching facilities around the nation, where a physician goes there who wants to perform that procedure and actually goes to that center of excellence and is trained by other physicians, experts on that particular device. And so they receive their training that way. So you get a sense of comfort of where that physician's been trained, who that physician has been trained by. And again, it's just about research, a little bit of detective work, just to make sure that you're pulling together the best information you possibly can as it's presented to your clinical leadership, because they're going to be the ones that make the final decision on the criteria, because there's going to be a lot of factors to take into consideration, which one of those might be, and you're familiar with this, if you're in a rural area, it's going to be, the requirements may be a little less than what it would be for a more metropolitan area. So there will be things that you do take into consideration, but that will be up to your clinical experts, your leadership there, and that's what your accrediting bodies are looking at, is how involved they are, and if they've made the final say based on the information that you've brought to them. That's really what they're looking for. When it comes to medical devices, one of the situations I've run into when working with other hospitals is that they start doing all this research, and then they even get approval, and they don't even have the space for the equipment that they now have coming in, and possibly the financial resources, meaning also, do you have the right staffing? Because it may not be that it's just the physician. It may be that you've got to have other specialties involved in it, mainly allied health practitioners you've got to have involved in that procedure. So it's a team-based approach. So you've got to look at this from a global perspective. When you know that a new piece of equipment is coming in, make sure, and hopefully they know that before the privilege is even requested, but just do the double checking and make sure that you have all of your ducks in a row, I should say, to be able to provide the support for that medical device. Now, when I first started going to the FDA, I had people say, who cares? Why do you need to go to the FDA? Well, the reason I started to go to the FDA years ago is that it's the FDA that gives the approval on these medical devices. So you're going to find a summary of safety and effectiveness on this particular device, and it's going to give you the indications for use and the conditions of approval for this particular device. And you will find on there a good part of the time that they're going to say specifically that training is to be provided prior to the physician using that device. So I think going to the FDA is absolutely vital. And then the other thing that I think is important that to do is to kind of monitor the FDA. I can't remember off the top of my head, when there is a claim, I know that's not the right word, that's made against a product. There's been a recall, or there's been something has happened, and it's up to the hospital and the physician to report what's happened with this individual device. And I like to keep an eye on that every now and then, so that if that's a piece of equipment I've got in my facility and for some reason I didn't get the notice that there's a problem with that device, I need to know that so that I can notify my physician clinical leadership to say, hey, there's been a red flag on this particular equipment. We've got to be careful with the tip. There's a recall on it or something. The more educated you are, the more safe it is for the patient. And it also makes you more valuable as an employee because you're really keeping up on what's going on in your facility, even down to these kinds of details that maybe you wouldn't otherwise know about. Just a few warnings, and I know that you've heard this before, which is do not borrow privileges from a hospital down the street if at all possible. I know that time is short and you want to just get it done, and you know that the hospital down the street is probably doing the same thing that you're doing. You need to remember that your facility is taking ownership for your privileges. So if anything happens and your facility has not done the appropriate research and that you have a process in place to show how you did the research, if a lawsuit happens or even an audit takes place, you can't say, well, I borrowed it from the hospital down the street. Well, you can, but you're going to sound pretty silly. So you need to own what it is that you're developing in your own facility. So you can talk to people and maybe find out what their process is if you need a jump start. But we're kind of giving you that jump start now. So just be really cautious in borrowing privileges from another hospital DOPs. And that do not phone a friend. If you're stuck on something, don't call somebody and say, hey, what did you do? Now, if you decide to go that route and you say, hey, what did you do? You need to find out exactly how they do that. And then you need to replicate exactly what they did. Because as I've done that in the past, and I've been doing this for many, many, many years, and when I've gotten in a hurry before I learned how to do it the right way, I did a phone a friend. And then I went ahead and verified all the information that friend found. And I found out that some of the information that was given to them was false information. And it scared me a little bit because I would have been the one to present this information. And so I want to be sure that I'm going to a credible source that can give me the exact information that I'm looking for. And then the absolute worst of the three that you can do is to guess. Don't guess on what you think the training should be. That is the absolute worst thing you can do. For instance, you can't say, well, he is a board certified orthopedic surgeon. I mean, surely he can do this. And I'll give you an example. I did not guess at this, but you're going to get some, if you haven't already. I'm sure everybody has war stories. I know they do. But I had received a phone call from a hospital up north, way, way out in the sticks. And they had an OBGYN who was requesting orthopedic surgery privileges, and they wanted me to do some research on it. Well, I was stunned for a few minutes, and I said, let me see what I can do. And I hung up the phone because I was repeating in my mind what was just being asked of me. I had an OBGYN that wanted orthopedic surgery privileges. Now, I understand why they were asking, because they were in a rural area and he was the only doctor. But I researched every which way I possibly could to grant him even one thing he can do as an orthopedic surgeon that they could back up. And there was absolutely nothing without him receiving the training that an orthopedic surgeon receives. Now, I know some of you, if not all of you, have received some really bizarre requests. Now, you can go ahead and say, let me see what I can do, but you make sure that you research it every way you possibly can and not just make a guess at what they probably could do. Because again, you put the patient at risk, the doctors at risk, the hospitals at risk, and you just don't want to go there. So keep those things in mind. Other things to keep in mind, as you're doing this is that, you know, your information is only going to be as good as the time that you put into it. And I know that a lot of you are scratching your head going, I just don't know how I can do one more thing. Well, unfortunately, you're going to have to figure that out or seek out some help on how to do that, because this is really, really a vital piece of the credentialing and privileging process. You know, credentialing, I think we're all really familiar with, and there's really no big hidden secrets on how to do credentialing. It's really pretty cut and dry. The privileging piece is a little bit more complicated. It's actually a lot more complicated because training is so vital. The quality of the equipment is so vital. Staying informed on when criteria changes. For instance, there might be maybe a training program, the ACG comes out, and where I'm just throwing this out, maybe in cardiology, the heart transplants is now part of core training and a fellowship, whereas you know, maybe it's a special privilege right now. That's why you always want to comb through your privilege forms even to find out what's changed. So a recommendation would be for you to, as you get to the point where you've developed your delineation of privilege form for your specialty, put it in your bylaws that you're going to review these every 12 to 18 months so that you don't have this horrendous task that you have to do every 5 years or every 10 years. And I've been in some hospitals, and I'm sure you have too, where they're still on a copy machine and they're barely fusing the ink on the privilege form. And it just leaves so much room for error and a mistake, and it confuses the OR nurses that are trying to schedule privileges. So the most time you can put into it, the better quality of privilege you're going to have. And also, if you decide to go, you know what, I've really got to revamp my privileges, this is what I'm going to do, don't worry about those physicians that have been there for a while. You can grandfather those physicians in, especially if they've not had any problems in their privileges. You can grandfather them in, so then you can start them fresh, start your new privileges fresh, right? Maybe at a reappointment time, you might want to do all your specialties at once. You might want to do just one specialty. So that's just kind of a little word or two on the rollout period of it. But I just want you to know that the research is really, really vital. There's a lot of information that's out there. It does take time to do it, but putting the time into it will pay off. And you'll learn a lot of really cool stuff also. So that is pretty much the where I'm at with the research and development. And if you have any questions, I'd be open to hear any of those.
Excellent. Thank you so much, ma'am. First, we're going to have a really quick word from symplr. I would love to introduce Ms. Joni Orand. She is one of our lead knowledgeable people here within the organization, and she's going to take a minute to talk to you today.
Hi, everybody. This is Joni Orand. Some of you may or may not know me, but I've been with symplr for about 10 years now, so it's nice to meet you by phone. Julie has just done a wonderful job of going over privileging, why it's important, how to do it, and all of the wonderful knowledge that you probably joined today to learn about. And hopefully you're going to have some good questions for her. And I would encourage you to have questions because she is a plethora of knowledge. So if there's anything you would like to know, if she can't answer your question today, I'm sure she'd be happy to research it for you. So take advantage of her time today. As far as the symplr side, we're sponsoring this webinar today for you, this learning experience. So now that Julie's gone over this and you know everything you need to know for privileging, I'm sure we are ready to go. All right, Kelly, hit it. Next slide. So here we go. It's time to get going. If this kind of looks like you, it says, let's give Susan a moment to compose herself. This is how a lot of, I worked in hospitals for many years. I've been in healthcare for a long time, and this is how I have felt from time to time in trying to wear about 30, 40 hats as you all do every day. So what you do is extremely appreciated, and I'm sure this is how you feel at times. All of this knowledge that Julie just shared with you is great. All the places to research, all the things to do, but if you're like most of us, you probably don't have, a couple hours a day to reach out to all of these sources and look up this research on your privileging. Okay, Kelly. So if you feel like that, we understand. We are here to help you. So our Cactus and symplr Privileging product can certainly be of help to you. So we would love for you to take a look at it when you have time. It would save you a lot of time and resources. Julie's been explaining today through her 25 years of experience about her team and how they do this on a daily basis. So let her do it for you. Let her team and our symplr team do this work for you. If you use our, go ahead, Kelly. If you use our privileging application or our privileging product, it would certainly save you that time and resources on your end as far as doing all this research. And some of you still have your laundry to do per se. You have these laundry lists, or you have everything on paper or privileging cards. Go ahead, Kelly. So if you have it in that kind of a format, we can certainly help you with that. We have a live database, a privileging library, and you don't have to worry about everything on paper, all your laundry list, everything. We will get those core and special privileges that Julie's explained with all of that criteria and content included for you. So if you want to take a look at that product, it is a library that has all of that there for you. And as Julie explained, there were some different threshold criteria associated with those special privileges. And she talked about how you would need more proctoring or training or education post-residency with that. So we'll also provide that threshold criteria for you so you don't have to go and research that. And by threshold, I just gave you a definition of threshold here, the magnitude or intensity that must be exceeded for a certain reaction, phenomenon, result, or condition to occur or be manifested. So that is the definition of threshold. So certainly intensity, certainly magnitude with your privileging, and you need to know how they must exceed what they already know in order to perform those special privileges. So we can certainly help you with that. Now, threshold criteria, like Julie said, is defined as what the practitioner needs post-residency in order to perform maybe a new piece of equipment or use that or new privilege that you have. So you're going to need that additional training, proctoring, or education. Well, what is that training, proctoring, or education? What does he need? Well, that's what we're going to provide for you. So we'll provide all of that required criteria, including anything they need for reappointment. And just keep in mind that all of that is also editable and configurable. So every hospital is going to want that to look different. You might like what we give you, but you might want to say, we want to change this one sentence, or we want to take something off here, or whatever you need to do. So that's certainly all editable as well, but it gives you a wonderful, 2 or 3 year head start because we're going to provide it all there for you. You can also put signatures on there too, by the way, if there's committee signatures and things you need on that threshold criteria. Now, all of our privileges in this library are also tied to ICD CPT codes. We have all the ICD-10s in there now. Our team has worked diligently and very, very hard to get all those codes associated with each privilege. So when you pull up our privilege in our privileging library, you'll see the work that our team has done on this side to include those codes. And then those codes can be fed in if you use Cactus credentialing or any credentialing system. We can also pull those codes from your EMR, like Epic or McKesson or Meditech, and we'll pull those ICD CPT codes on a weekly basis. We'll set that up with your IT department. And then we can line up those codes with the actual procedure that's associated with that code. So then we can give you a privilege to procedure type report. So Dr. Smith might have 10 privileges, but when we pull that, we'll see that she has performed 9. So we might want to help with our FPPE and OPP there and just say we need to do a focused evaluation to make sure she can still perform that privilege. Or maybe we give you that report and you see that she's performing a privilege that she doesn't have. You might have a coding error, or it might just be that she's using a new piece of equipment we didn't realize she was using, or whatever the case may be. Again, a great opportunity for a focused evaluation. So certainly, I hope you've enjoyed Julie's presentation. I hope you have a lot of good questions for her. if you have any questions on this side as far as using our privileging library and getting all that research done for you, feel free to contact us here at symplr. Thanks, everybody. It was nice to meet you.
Thank you so much, Ms. Joni. And now we're going to move on to the question and answer portion of our webinar. You can submit your questions via the chat box located on the right side of your screen. All right, Ms. Julie, I have had a question roll in that says, are you saying that we should save all research documents? If so, for how long should we save them?
Most of the documents that you will have, you'll be able to tie to a website link. And what I would do is I would just note the link, the internet link on your specialty page somewhere, or on a research document, and then you wouldn't have to keep all of that paperwork, because there is a lot when it comes to the medical journals that does tend to stack up. But if you have an ability to go back directly to the source, which again is usually through a web link, I would just keep it that way, just so that they know where they can go to get the direct information. I hope that made sense.
All right, thank you so much, ma'am. Joni, this may also be a question that you can help answer with. Our next one is, our physician team feels like the core list in your product are too detailed, since we are not looking at tying them to ICD codes. Are there any suggestions on streamlining those to fit our need?
Absolutely, great question. We probably just need to provide a little more training for you on that product. There is a way for you to remove those from your list, and we can teach you how to do that. And if you're used to looking at it, there's a little box to your list with check marks in them. You can uncheck them and hit submit, and that will take them off of your list completely if those are not ones that you all perform. There's also a little edit pencil beside it where you can change the name of it. And so all of those in there are actually editable, and you would be able to take them off your list or edit them appropriately. So if you just want the content and some of those don't apply to you, certainly feel free to do that. And if you need more training on that, let us know. Just fill out a support ticket and we can get you some help with that.
Excellent. Thank you so much. I will actually, Joni, I will connect you with who asked that question. That way y'all can work on that. That will not be a problem. All right, that seems to be all the questions I have at the moment. Everyone seems to still be digesting it. Miss Julie, did you have anything that you wanted to kind of say that you didn't really get to touch on, or something that you wanted to elaborate more so on?
No, just want you all to know that this is overwhelming, what you're being asked to do if you're taking charge of the research and development of privileges. And if you're having to start over and maybe you haven't looked at your privileges in years, my suggestion would be, as you go through this process, is find a physician advocate, maybe a department head that is willing to help you get your privileges cleaned up. And once you get one physician and department head or section head ready with their privileges, then pretty much the other ones start to fall in line. It's hard because when you're going through this process, sometimes physicians think you're trying to take something away from them or you're trying to give them more things to do, which you're not. You need their involvement. You want them to ultimately call the shots. You just want to be the one that has the backup information to do that, to support them. And that's what this research and development is really all about.
Excellent. Thank you so much, ma'am. Ms. Joni, do you have anything you'd like to say in closing to our audience?
I do not. I appreciate everybody's time. And if you all do have questions, feel free to ask or email us. We'd love to talk to you about it. If you're a current client, like the former question we had, where you have some questions about how to better utilize the application, we can do that. So certainly submit a support ticket if you're a client. If you're not a client, feel free to contact us and we'll help you in any way we can.
Excellent. Thank you so much, ma'am. I would like to reiterate that you will be receiving information to download today's slides and also watch an archive of this webcast from communications@symplr.com. If you would like to make sure that you get that email, please add communications@symplr.com to your address book. That way you can also get invites to our future webinars. We do have more coming up this year, and we hope that you join us. Please keep checking the resource library on symplr.com as we announce those new shows. I believe that's about all the questions we have today. So I am good. Miss Julie, would you like to say anything in closing before we wrap this up today?
Just thank you so much for participating, and if there is any way that I can help you at all, please feel free to contact me. My contact information was there at the beginning, and I would be happy to answer any questions or to steer you in what I perceive to be the right direction.
All right, thank you so much, ma'am. And again, thank you everyone for joining us today. We hope you have a wonderful rest of the day, and we look forward to seeing you all on future webinars. Have a good day, everyone.